Good morning to my lovely audience. Today I'm in our office in Tirana and I have Dr. Erista Fili with us, an experienced implantologist, and not only, she is a superstar in the industry. Smile Factory is the clinic that we are going to discuss today, and I'm very excited because we are also talking about precision in surgery with guided surgery. Let's welcome Dr. Erisi.
Thank you, Marcella, for your invite.
You're welcome. I'm very excited for you to be here.
Also, for me, it's a pleasure.
I want to learn all about your journey. I know we've been talking a little bit offline, and I've got to know you so much more now. And I believe that we'll have so many discussions together because you are like a box of information, and all people out there would want to learn so much more from you. But let's talk about Smile Factory today. How did you become a dentist? How did Smile Factory come by? Go on.
Okay.
All yours.
Being a dentist wasn't by choice.
Okay.
At first, I wanted to be a doctor, like
Okay.
everyone in here. And after that, we decided that dentistry was better. And then I started to like it while I was working until I found surgery. Surgery was my safe spot.
Okay.
And I become more passionate about it during the time that I've been working. And so I've specialized in that field. The clinic has been in Tirana for 8 years now.
Wow, okay.
My experience is almost 10 years. And I've done a lot of cases, surgical cases, but also general dentistry and all other kind of transformation. So tell me, how was your experience with us?
Oh, I feel like I am in really good hands. And you alleviated all my fears, which were a lot. And I feel like this was just really quality care, and I really appreciate it.
Thank you. Thank you. You're welcome.
So I know that your passion ground is, as you said, surgery, and you've talked to me about guided surgery, and it has really intrigued me since the moment I heard the keyword. So obviously, I've done a little bit of research, and I know it talks about precision and safety measures, and I guess predictions as well. But I want to hear it from you.
Well, guided surgery should be in the hand of the dental surgeon. Guided surgery cannot be used by dentists who have been practicing surgery not daily. As such, it's the perfect, for me, it's the perfect practice, non-invasive. I need to tell that and
stress that out.
To say it precisely. Guided surgery is a guide that is plastic, that allows us to predict precisely everything that we're going to do in the patient's mouth, in implant in that case. It makes also, as long as you know the anatomy and everything, guided surgery knows how to go. Has stoppers, don't let the dentist to make mistakes. As such, it's 100% precise and safe for the patient.
So it's a tool that experienced surgeons can use. So it's not to be used by anyone.
Yes.
You already need to know how to do the surgery without it. And so this is just an extra new tool of technology that allows you to make precise decisions.
Yes, of course. And also, it's something that when the patients come and we take the impression in a digital way, the patient know how it is going to be the final result.
So you can actually see
and
it. The patient
you can actually see it, and also you can actually reload it. The provisional teeth. Because 72 hours after the surgery, mentioning the fact that it's not invasive and the patient is not lacerate or with blood everywhere in the mouth, that is the surgery itself, allows us to make a reload.
How do patients take this piece of information? Do you explain it to them? Do they know?
Of course.
Or you just use it?
No,
it's
okay. Of course, in every step that we do, I want to interrupt you in something if I can
Yeah,
if I
of
can
course.
say it right now. My clinic is a dental studio. It's not a big dental clinic because I have invested in technology rather than in a place when it's Instagrammable and beautiful.
Yeah.
You know, it's also beautiful, but I wanted to invest in such things. As so, I take one smile makeover at a time. That means I don't have patients waiting for me while the patient is already seated. I take all the time needed for that patient so we can discuss before what we're going to do, and also make the patient realize and understand every step of the procedures.
So, from my understanding, using guided surgery, will it save time or does it add more time? Because there's a lot of explanation to do to a new.
Okay. Well, everything that I explained, it's been practicing around 5 to 7 days.
Okay.
From the moment that the patient comes, that the impression is taken, up to the provisional teeth. So, in that case, if you come and you make implants, you can put a reload in them.
Immediately.
I'm saying in the surgery that is not made by guided surgery. In guided surgery, you can put the reload immediately. So in that case, it takes more days for you to stay in here, but it takes less days for you to come to revisit us after 6 months, to make the provisional
So the
teeth,
next
and then
visit is
the next visit. So it's
quicker.
less visit, but more time.
Yeah, makes sense. That's
Staying
fine.
here.
I'm curious, do patients know about this before they come to you, or do they learn whilst they're there?
Okay.
Are you chosen precisely for this, or?
My experience working with patients, the patient needs to know before this. They have to have a lot of information about it, to check about it, to see the safety of this thing, because it's something that not every patient knows.
Yeah.
And as such, when they come, they learn precisely every step through it. But I'm open to discuss even before with the patients if they want to make that kind of surgery, to discuss with them before and to explain to them before all of the steps during the way.
And this is not painful. It doesn't hurt.
No,
Okay.
no, it doesn't hurt at all.
Okay.
That's why I've chosen this because, as I said, surgery is traumatic.
Yeah.
Technology has made something that it's less traumatic for the patient, and also the patients are afraid. A lot of patients are afraid of blood. In guided surgery, we don't have blood because we don't lacerate.
Okay.
As such, also the post-operative part is more comfy for the patient. The patient can right away eat. Of course, need to take the prescription for from the doctor about everything that they're going to do during this time. But for me, it's been I don't know, a lifesaver.
That's great, amazing. Can you talk me through the if I was to pretend I'm the patient and I'll walk into your clinic thinking I need an all-on 6 for my upper jaw, what would be the process? Obviously, beside the consultation and the decision making, where you explain to me about guided surgery. But once we've decided, yes, we're all good, let's go. What are the first steps?
The first steps after consultation, it's taking the digital impression. After that, the digital impression goes by mail to the lab. The lab makes the dental treatment, surgical treatment, and then we show the patient how many implants are possible for them to be accepting.
Yeah. Okay.
In that case, maybe 4, maybe 6. There are patients who want all on 6, but their maxilla, in that case, doesn't allow to make 6 implants. Comfort, that's what I want to talk, and that's what I want to clarify. My clinic, it's made to make people feel comfortable, because even me, I'm afraid of dentists.
Oh, you're
yes.
You're the bad patient.
And as a patient, I want to make also other people.
You relay and
other
understand.
people feel comfy.
That makes sense, and I think it's definitely a very nice thing to say, and that you understand and comprehend what your patients could be going through, because even dentists have teeth, so even you have to go to your colleagues at
Well,
some point.
I've been through every dental procedure.
Okay.
It means that I've extracted a tooth, I've made, I don't know, a lot of treatments in my mouth, so I know precisely how to tell to the patient what he's going to feel and how can we make it less invasive.
Less invasive. So with the surgery, so we talked about you take the impression. So where do the patients see? Because you mentioned that they can see
after the plans come. Also with the surgical plan comes also the other plan of the teeth. And when the patient have his teeth in his mouth, he knows how to describe what does he want, what doesn't he want,
the possible outcome.
Yes,
Yeah.
the possible outcome. So they can change the color, the shape, and everything. We can discuss in that moment. So when the patient comes, we know what are his expectation and what can we change for the final makeover.
And as a patient who has a lot of questions, I'll be like, oh my God, doctor, he's now have so many options. How do I choose my smile?
Well, we choose that together.
Okay.
It means I give you suggestions. At the end is the patient who decides according to the parts that he can decide.
Yeah.
So we make this thing together.
Okay.
It's better.
You have them.
Of course, with letting the patients know that sometimes the patients they have seen, I don't know, they've seen the IMAX and the Hollywoodian smile.
Yeah.
But there are some points that we should discuss with the patient. It means, okay, you may want that whiteness teeth, but that one doesn't go with the shade of your face or with the other parts of the face. So this is the part that I discussed a lot, that takes most of my time during the consultation, because I want to make people to feel comfy in their natural smile. My point is, so the patient can go out the clinic looking like he hasn't made anything.
Yeah.
That's it.
So natural that
So natural.
no one would know that you've had a
dental
treatment. So no big, very white fake smiles.
My suggestion is not. I don't work in fake smiles. I want to do slow dentistry, natural dentistry, and as such, the patients that come to me, they know what I do, and they precisely want only that thing.
Yeah. Oh, that's really good. I really, really like it.
But also during the platform, the patients can see also the natural changes that we have made in the clinic. I've also like a lot the prosthetic part, and I've trained in that precisely in Spain about the prosthetic part between. Well, I'm going to describe it in another way, if it's possible.
Yeah, definitely.
Because I want to feel confident with what I'm saying, and
let's safely assume that
leaving aside the part when I talk like a dentist. I want to talk like a patient.
Exactly.
The most difficult part with dentists everywhere, not only here in Albania, because here in Albania there are a lot of doctors that they are qualified, well trained. It's the fact that not a lot of these dentists are specialized in implant prosthetic.
Okay.
It means there are a lot of implantologists who are perfect. There are a lot of prosthetics who are perfect, but there are a few people who knows how to make these two connected. As such, the connection between them shows the success of all the makeover. So I've been trained in that, in the reloads of the implants and the prosthetic part. So that is my strongest point.
Sounds all really promising. What is this guided surgery? What tool is it? Can you share a
It's plastic.
brand?
It's plastic. It's like Invisalign that we use for to straighten our teeth. It's the same thing, but has stoppers in it. So the dentist, when applies the implant, stops in the part that the guide says stop.
Okay.
That's why it's 100% safe.
Okay.
It's plastic, nothing less.
So okay, that's fine. Makes more sense. How, how long does this prolong, or if I was to rephrase it, does it add much more time to the actual surgery? So if you were to say, look, I know what I'm going to do, 12 o'clock tomorrow we get started, you'll be done by 3 p.m.
It takes 2 days more until,
days.
yes, 2 days more. Because it's the digital impression what takes time. The patient can take the digital impression elsewhere at the place that they are and bring to us. So in that case, we can make every
It's
treatment faster. So what we need from the patients is a 3D scan. And after that, we can say such or so the number of the implants that they're going to make.
As an indication.
As an indication. But it takes, I guess, 2 days more.
2 days more. Okay, that's fine. And I guess a lot of people are happy. I think you've sold it to me when you say you don't see blood.
Yes,
so
that's the
box ticked.
The funny part.
Yeah, no, amazing. Can you share a success story with me? Someone who was, I don't know, super afraid, didn't know about this.
Well, the beautiful part of it all is that to me come a lot of patients, not to say all of the patients that come to me are dental phobic. Okay. And in that case, we also have a solution because I also work at another place. It's a hospital, and when the patient has problems with he has fear to going through all the procedures, we can use sedation in that case to make every procedure while the patient is sleeping. But I guess we'll talk to that in another time precisely because it's
much more involved.
It's much more involved.
Yeah. Thank you so much.
Thanks a lot.
And we'll have you here again in the future. To my lovely audience, you know what comes next. Sirena.
Thank you everyone for joining us on today's podcast. Stay tuned for more and don't forget to follow us on our socials.